Do you suffer from low back pain? Let's talk about some postural compensations that may be contributing to that. My name is Greg. I'm a physical therapist and founder of my business, Prehab Solutions, where I apply rehab principles but apply them proactively. So my goal here is to talk about what are some common things that I see in the clinic and with my clients as to postural compensations that may be contributing to their low back pain. So first one I tend to see is folks have a little bit more of a forward head and rounded upper body posture. What this starts to do is put us into a little bit more of a flexed forward position, and it causes increased tightness of those muscles of the low back. What it does at a deeper level, it puts our spine into more flexion and compression of the disc and bone spaces, as well as a distraction force of the joints and the ligaments around the joints. All of those can be a pain generator and or a creator of muscle tension because those muscles are having to work harder because of the response that we're having at the spinal level as well as the connective tissue level. I often see people have an excessive lean to one side or the other, and this could have a lot of different reasonings behind it, but we can all think of that one person, or maybe ourselves, if we will look at ourselves in the mirror and we're honest, that tends to kind of lean to one side or the other. They excessively load on one side, they kind of offset on the other side, and that starts to put their spine into a little bit of a tilted position here that may be causing a little bit more compression and distraction on one side, a little bit more hip irritability. So that's something that we got to think about, is this side to side plane of motion compensation. And then pelvis positioning. I think about this in standing, but more often in sitting, where the pelvis can be either excessively tilted one way and tucked underneath us, which is going to be more compression into the disc and bone space and distraction or opening of the joint space, or in the opposite direction where maybe their tail is a little bit more out this way and they're arched in the low back, which is more joint compression versus distraction and opening of the front of the spine. And so those are things that could be contributing to muscle tightness in that region as well. And so these could, again, happen for a variety of reasons. Maybe there's mobility deficits. Maybe the area of the lumbar spine or areas above and below have either too much motion or not enough motion. And so those muscles react to that. If we're stiff and rigid and can't move, we can't get those tissues to glide and change their fluid environment, so they're going to become stagnant and irritable. Or maybe there's too much motion. There's an instability of the lumbar spine or other regions of the body that's causing those muscles to tense up and say, we can't let go because you can't control that motion. There could be weaknesses. And so if we have weakness of the core, the hips, the lower half, maybe some weakness in our shoulders and our postural muscles that kind of cause us to be in this little bit more stooped state, then those muscles back there are going to say, now I'm overworking, I'm irritable, you can't control motion in these other places, so I have to tense up to help kind of protect the low back. I'm stuck in the middle here. And then other parts of this could just be general awareness. And especially with kind of our stances where we're leaned off to the side just a little bit, that's as simple as being aware of our foot positioning and kind of how we place our feet underneath us, working on some weight shifts to kind of refamiliarize ourselves with equal weight distribution through our feet and our legs, and then postural awareness when we're standing, whether we're operating something, working, maybe we're at our standing desk doing some typing. And so being a little bit more aware of what our body tends to lean towards, but then other ways of adapting and changing that. So this is where my functional mobility assessments I think are really, really important. You kind of get a tune-up. You get to go meet with a body mechanic and take a look at how am I moving, not moving, where are some aches and pains at, and what are some possible contributing factors, not just locally at where I hurt, but also globally, what's either pulling its weight or not pulling its weight that could be causing this to be over-irritated. So if you have any questions on this or would like to discuss more as far as a functional mobility assessment or education, I'd love to talk to you about it and see what we can do.